vein and use it also for posterior wall ablation. The CTI line will be to be performed with this focal catheter. It has 4 electrodes, and this catheter is 8 French sheet, and the flower catheter is 12.5 French sheet. It comes in a 31 and 35 millimeters diameter. Just one note that the Ferapulse catheter received approval yesterday for paroxysmal atrial fibrillation, but not persistent AFib. So what you're going to see here is an investigational use of the catheter. So we're going to start this procedure here. So I'm going to take you through the procedure from start to finish. This is our workflow. We put a coronary sinus catheter in. We pace the phrenic nerve. This is baseline recording of the right and left phrenic nerves. We're going to do next transseptal. Before we do that, it's our standard workflow to look at the left atrial appendage with ice. Clear it. We almost never do any TEEs anymore in the lab. This is the view of the appendage from the right flow outflow tract. You can visualize it well. Assess the pericardial fluid at baseline. So you folks feel free to stop me for questions here, otherwise I'm going to keep going. So a couple of words about the transseptal. So for these procedures, the multi-electrode catheter is about 31 or 35 millimeters. So when you ablate the right inferior pulmonary vein, you need to have some distance between it and the site of the transseptal. So as you see here, we aim for a more anterior stick for the transseptal puncture compared to what you would have done in a typical pulmonary vein isolation with a focal catheter. So we aim for anterior stick. I think that's important to give you enough space to turn and get the right inferior pulmonary vein. This is the sheet going in the left atrium. It's a 17 French outer diameter sheet. So what you're going to see next is the ablation catheter going in. It's an over-the-wire system. The wire is going into the left superior pulmonary vein.
You want to talk for a minute about the kind of wire that you're using, Musa?
Yes. So the wire is it's a J-tip wire, and anything else specific?
No, just so Cars, Nevin has published a couple papers, or maybe it was one paper, where they used the straight tip guide wire, and when they did bronchoscopy, they saw some clots in the bronchi.
Yeah. So I'm going to talk about